Ryan here. I'm a board certified specialist internist. Thank you so much for joining me even as we navigate our way through arthritis today. I strongly encourage you to subscribe to my channel if you haven't yet done so. Righto, so what really is arthritis? Arthritis describes inflammation involving any structure within a joint. Now, not joint as in joint as in joints between our bones. Articular structure involves or includes the synovium, the synovial fluid, the articular cartilage, the intra-articular ligaments, joint capsule, and the juxta-articular bone. Now, mimics of arthritis includes bursitis, tendinitis, enthesitis, epicondylitis, ligamentous damage, cellulitis, deep vein thrombosis, polymyalgia rheumatica, myositis, and periarticular bony lesions. An articular process is suggested by the presence of pain with both active and passive range of motion and joint line tenderness on palpation. Those are highly suggestive of arthritis. Arthritis, by and large, we can cut it into being inflammatory and non-inflammatory. And inflammatory is further certified based on the number of joints involved. So monoarticular is just one joint. Oligoarticular is between 2 and 4 joints. Anything with 5 joints and above is polyarticular. Okay. So other inflammatory musculoskeletal conditions such as tenosynovitis, enthesitis, and dactylitis, so-called sausage digits, can occur with certain types of inflammatory arthritis. Synovial fluid white cell count is the single most important laboratory test in the evaluation and workup of inflammatory arthritis, where the white cell count is usually above 2,000 cells per microliter. This is consistent with inflammatory arthritis. Okay, let's look at the different causes, right? So there's 29 causes of arthritis. Non-inflammatory, there's 9 causes. So osteoarthritis is the poster child for non-inflammatory arthritis. It's an erosive, non-inflammatory arthritis, okay? Then we got trauma, we get hemarthrosis, especially on the back of a bleeding diathesis. The poster child for that is hemophilia. Charcot's joint, right, which is basically the result of long-standing neuropathy, usually on account of diabetes. Right, osteonecrosis, hypertrophic pulmonary osteoarthropathy, and episodic arthritis of cystic fibrosis, acromegaly, and hemochromatosis as well. When we're looking at inflammatory arthritis, there's 24 of which are monoarticular, involving a single joint. Then we talk about crystalline arthropathies. The poster child for that is gout, but also you get pseudogout as well. Infectious causes in the acute and infectious causes chronic. TB, notably chronic acute, is usually gonococcal, right? Then, or this could be a manifestation, early manifestation of oligoarthritis, with the other joints being involved later on. Then oligoarticular, which involves, by definition, 2 to 4 joints. Here we're thinking disseminated gonorrhea, spondyloarthritides, right? That includes psoriatic arthritis, enteropathic arthritis, ankylosing spondylitis, and Reiter's syndrome, right? They all share an association with HLA-B27, the seronegative spondyloarthropathies. Then we get spirochetal infection, especially Lyme disease, Lofgren syndrome, which happens in the context of sarcoidosis with bihialadinopathy, peripheral arthritis, right? Henoch-Schönlein purpura, cryoglobulinemia, Behçet's disease, or oligoarticular could be an early manifestation of polyarthritis. And polyarthritis, by definition, involves 5 or more joints. There we're thinking typically a seropositive variety, rheumatoid arthritis, systemic lupus erythematosus, the wolf, viral infections, EBV, CMV, parvovirus, hepatitis, HIV, polymyositis, dermatomyositis, Still's disease, rheumatic fever, where we invoke the Jones criteria, serum sickness, especially due to penicillin, and of course sarcoidosis, right? So this is just from a bird's eye view taken from algorithms for differential diagnosis. You've got a clinical problem of joint pain. Let me just get my marker in there. So joint pain, right, can be extra-articular or intra-articular. Now, intra-articular, we cut it 4 ways, right? Acute monoarthritis, chronic monoarthritis, acute polyarthritis, and chronic polyarthritis. So acute monoarthritis involving just one joint. If it's acute, usually traumatic, or it could be atraumatic, in which case if there's an infusion, you want to do a joint aspirate and send it off for crystals, cells, and culture. And then you diagnose either gout or pseudogout on the basis of the crystals that you find. So gout, we have monosodium urate crystals, which are negatively birefringent, versus pseudogout, where you get calcium pyrophosphate crystals, which are positively birefringent. It could be septic arthritis, or it could be non-diagnostic. In the setting of chronic monoarthritis, it can be mechanical or inflammatory. Mechanical, the poster child is osteoarthritis, or it can be involved with some extra-articular structure, like a bursitis or a tendinitis. Inflammatory causes include that of infection, tumor, gout, and pseudogout. But polyarthritis can be acute or chronic. Acute, we talk about infective causes like septic, gonococcal, and viral. Non-infective is reactive, undifferentiated, right? Chronic polyarthritis is a different kettle of fish, right? Where first up, we certify either mechanical or inflammatory based on certain parameters. Is the rest pain for greater than 30 minutes or less than 30 minutes? Is it associated with raised inflammatory markers? Right? So if it's mechanical, usually we're looking at osteoarthritis. If it's inflammatory, the next question is there prominent systemic involvement? Then you consider systemic lupus erythematosus, systemic sclerosis, etc. If no, ask is it axial or appendicular? If it's axial, you're thinking about the HLA-B27 associated seronegative spondyloarthropathy. So we said psoriatic enteropathic arthritis, ankylosing spondylitis, and Reiter's syndrome. If it's appendicular, we look at the distribution. If it involves predominantly symmetrical small joint polyarthritis, we're thinking about rheumatoid arthritis. But if it's asymmetrical oligoarthritis, then we're looking at peripheral spondyloarthritis or gout. Alrighty. Okay, my friends, let's just talk a little bit about spite. What are the consequences of envy? And the mnemonic is spite. Okay. So first up is self-destruction. The book of Job, chapter 5, verse 2 says, "For wrath kills a foolish man, and envy slaves a simple one." Okay. The next one is perplexity. The book of James, chapter 3, verse 16 says, "For where envy and self-seeking exist, confusion and every evil thing are there." I stands for ill health. Proverbs 14, verse 30 says, "A sound heart is life to the body, but envy is rottenness to the bones." Wow. T is for temper. Proverbs 6:34. "For jealousy is a husband's fury, therefore he will not spare in the day of vengeance." All right. And the E, as we know, stands for evil work. James 3:16, once more, quoting that again. "For where envy and self-seeking exist, confusion and every evil thing are there." Acts 17:5. "But the Jews who were not persuaded, becoming envious, took some of the evil men from the marketplace, and gathering a mob, set all the city in an uproar and attacked the house of Jason, and sought to bring them out to the people." Spite can never produce anything good, my friends. And I pray that we will choose to be considerate, to be humble, and not to be envious and covetous. All right, have yourself a fantastic day. I'll see you soon with another rapid review video in internal medicine. God bless and take care.